everybody. This is Deception in Healthcare in America with Kathy, Ann, and Jennifer. And today we're going to be talking about the Coronary Artery Calcium Scan. So, this scan is a non invasive CT scan that checks for calcium or plaque in your arteries. And finding the buildup early can help you understand your risk for heart disease or a future cardiac event. So, heart disease is actually the leading cause of death. Okay. And in the United States, someone has a heart attack about every 40 seconds.
Wow.
Yeah. And so I have the statistics for 2003, and a little over 919,000 people died from cardiovascular disease. So that's about 1 in 3 deaths. So just so you know, a heart attack occurs when an artery that sends blood and oxygen to the heart is blocked. They say a lot of the time it's blocked because of fatty cholesterol containing deposits that build up over time and they form plaque in the arteries. So you can get a calcium score test, or otherwise known as a coronary artery calcium scan. It goes by a few different names, and it looks for the calcium or plaque in your arteries. And the coronary artery calcium test is the best test for determining risk for heart attack in people without symptoms, and it's said to be highly accurate and helps with early detection. So, the reason we're talking about this test is because I had one done last month. And the reason I had one done is because I went to my doctor for my yearly checkup and I had a lipid panel done. So, I'm going to tell you that I did not fast for this. I don't know what I was even thinking. My appointment was at 2 o'clock. I ate before I went there. And,
And you
and
still had fabulous numbers.
but these were my numbers. My LDL was 172, and they actually want this number under 100. So this is considered high. And actually, I looked this up, and anything over 160 is considered dangerous. My HDL was 62,
Which is good.
and my triglycerides were 126.
And that's
Um,
because you ate. I'm guaranteeing you all that would have been different had you not eaten that morning.
Next time I'll do that. But I actually have the numbers. I had gotten a lipid panel for my insurance company just like 3 monmonths before, and I
Mhm.
have the numbers.
Oh,
Um,
okay.
so and I guess this can show you what fasting and non-fasting will look like,
Mhm.
because
You
these
should
are
always fast before a lipid panel, always.
so this is my fasting one. So my LDL was 180, so it was a little bit
Mhm,
higher. My HDL was 66,
mhm.
and my triglycerides were 83.
See, there you go.
There yeah, just like
There
you
you
said.
go. Exactly.
Just yeah, what were your numbers?
My triglycerides were 67 and they haven't been over 72 is the highest I found since 2020. And I want to tell everyone I started out with triglycerides of 988.
Oof.
And I actually was put on a phenylfibrate to drive those down, and it drove my LDL down. It drove my HDL, the good fats. It drove everything down, and it drove I think my total cholesterol was like 160. And this was just when I was eating pretty much like anyone else. I wasn't eating a lot of fast food or anything, but I mean, I was like this was before like I just was I was supposedly a type 2 or whatever, and they hadn't really figured out that I was type 1, and I was using insulin and all that, but my metabolic system was just it was in shambles, and so that's just what it looked like. And there's some genetic factors in there. I found out my grandma and my aunt on my mom's side, their triglycerides run higher. But anyway, I found out so not only was I fighting a genetic type disposition here, but also just yeah, metabolic system wasn't working probably because I wasn't being treated for type 1, sitting here trying to treat it in the dark like a type 2. But anyway, ended up finding out my son's was like high from eating now. He was eating fast food. Now we changed his. He just stopped eating fast food and he quit Dr. Peppers and turned it around. And he'll go up and down with his because he's young and stupid. But but yeah, I've gotten mine down from 988 with food. I did the phenylfibrates at first, made me just feel bad. And I went and did some research and got it down. It took me a solid 2 years. I started incorporating healthy fats and I started taking all those bad fats out, all your your different oils that people use. I got rid of canola oil out of my house. I switched to grapeseed oil. And I'm like, okay, that grapeseed oil is not healthy. Anyways, I switched to I do avocado oil mostly, but you'll just notice all that changed my numbers, just all those things over time. 69 was my triglycerides, 67 for an HDL, which you want at like 60 to 70. That means you've got good fat, your body is storing the good fat, it's utilizing the good fat. My LDL was 170. Now that number is actually basically just it means nothing. It just tells you there's cars out on the highway making all these other things happen and, storing fats and transporting fats where they need to go. It's out moving around the highway. You don't want that number. So like if you take a phenylfibrate, you knock that number down to say, oh God, I don't know, let's just say 100 or something. And the doctor's like, oh, that's so fabulous. And then you look and you have an HDL of, let's say, 40 or something or 30. I've seen people with this, right? And then let's say their total cholesterol, woohoo, you're 150, you're 160, you're doing it. You're perfect. Oh, wow. It's like, no, that if I saw that, my heart would probably drop immediately. I'm telling you, it would scare me so bad. I would really look at what am I doing and I would get to changing some things. I mean, right now today. But anyway, yeah, those are collective numbers. And so when you tell me, like I already told you before, you even told me what your numbers were. I was like, oh, you must have eaten. Because I know your diet and lifestyle and said that just doesn't sound right. That would be a red flag or very alarming if you had just fasted and had those numbers. If I want fasting, I need to go earlier in the morning, which
Yeah.
is why I make all my appointments like at least by 9. I want to be seen, you know?
Yeah. She knew I wasn't fasting, because I told her. But the thing is when she saw my number, she was like, "Oh, I need to put you on a statin." And I said, "No." I said, "Did you see my triglycerides and did you see my HDL? They're really good. And look at me. I'm fit. I exercise daily." And I said, "You're just looking at that one number, and I personally don't think that one number it means much." And she goes, "Okay, okay. How about we do the calcium scan test and we'll see if there's
Cool.
any plaque in your arteries." And I
Sign me
said,
up. Ready to
"That's what
go.
I
Not
said."
even
I said, "I would love to." So then she put in the order for the calcium scan, and my insurance doesn't pay for it, even though this is considered the gold standard of tests for your to determine heart attack. Insurance did not pay for it. It was $131 and I was in pretty quick, and I'll tell y'all kind of what I did. So it was at Baylor Scott& and White at their heart hospital, and so you don't wanna wear a dress for this, okay? You just wanna wear, like, a pair of loose shorts, sweatpants, and a loose shirt, and a sports bra, okay? Don't wear, like, lingerie bra, okay? But,
don't do it.
well, you can, but, I mean, they have to lift up your shirt because they're gonna put some electrodes, like, on the where your bra line is and on your chest. So I wore, like, mine is full coverage, so they put electrodes on around my chest area, and then I laid down, and it's like one of those MRI machines that kinda pulls you in, and then a voice says, "Take a deep breath and hold your breath and don't blow out." So then you hold your breath in, and then it says, "Okay, you can breathe again," and it does it like 3 times, and then you're done. So I
Very
think
quick.
it
Mm.
is very quick, but when they pulled me into the back room, I think it was probably less than 10 minutes for the total procedure, and then I got my results in 3 days. So the calcium test, how they rate it is, a 0 is the best score. A 0 means they found no plaque in your arteries, and anything over 400 is considered significant plaque buildup.
Mhm.
So what you want is a 0 or I think anything less than 100. So
Mhm.
I got a 0,
Of course
and
you did.
so I was really scared because it's not the first time I've been told I had dangerous LDL, okay? And so I was thinking, "Okay, well, my LDL is dangerously high. There must be plaque in my arteries," but when I got the 0 test, I'm like, "What the hell?" Um, this is, like, contradictory, to what I'm being told here. I'm being told my LDL is so high that it's dangerous and you need to be on a statin now, before you have a heart attack, and then I get the calcium test, and there's no detectable plaque in my arteries. I mean, That
And even when
it's
you
just
told me what they had said, I've been through that conversation so many times, just personally with my, every time I go in, they're like, "Are you ready to take a statin? Will you at least take 5 or 10 milligrams?" Nope. Well, you need to go get a calcium scan. They've asked me to do that several times as well. And it's like at this point, I just feel like the numbers back everything. So at some point, it's like, you did that for peace of mind. Because when you told me, I did giggle inside and I was like, Kathy Ann, don't worry about it. Like, I've seen your lab work actually for several years because we share our lab work. And I'm like, never at one time can I even go back and find one little thing to say, like, this is like a significant test. You literally paid for this test. It was for peace of mind. And
it
also it'll
was.
shut her up. So it is nice because now you guys can move on to something else. Like, don't bring this to me. Like, leave me alone about this.
Yeah,
But if people will just take their triglycerides and divide them by the HDL, the good fats, you should get a number of two or less. You just need a number to look at and to gauge. But you want that two or less. Okay. And I wanted to say my grandma had a widowmaker heart attack and her A1C was atrocious. Everything was atrocious. She had her lab work was a mess, okay? And this was in 22, I believe. Her triglycerides now run like around 120, something like that. I helped her with her diet, I wanted to say. And I've taught her how to fast and fast properly. I've taught her how to have a really healthy meal because we want to see what it is, how it works, which she pretty much just eats healthy all the time. I mean, she's really committed. She's been on a really like she's serious about this. She's 89 too, by the way. And she changed her diet. But I want to say her triglycerides are down. Now they do have her on a statin, but she just doesn't like taking medicine. She's old school. So I would never recommend someone like just sit there and say, well, statins are this and this and this. If you're following down that road of that path where we are, you're already different than us and you're already a different that's a whole different case. You should have a team of people that make those decisions that you make those decisions with and they make, with you. Like my grandma, I tell her, you don't just not take your statins. Like, if you want to take less, maybe talk to them about that. If your heart is in question in any type of way, you need to deal with your cardiologist team and your those people. Don't try to take that on yourself and read things and try to like, figure that out on your own. But as far as like with us, just taking everything in account as a collective picture and all your numbers and all your lab work and the consistency and there's nothing else going on. You're not having like all that. Anyway,
yeah,
take your triglycerides, divide them by your HDL, and what that does is your triglycerides tell you how well your metabolic system works as far as how well your body utilizes insulin. And insulin is a hormone, right? And we all produce it except type 1s. We don't produce it, but our bodies are meant to produce it from the pancreas. And so when you look at a person's triglycerides, it's going to tell you, it's going to drive every one of those other numbers in a certain direction. The LDL literally means nothing. What the first thing that matters is your triglycerides and your HDL. Those are very important. HDL is good fat. It's how well your body is storing good fat and utilizing good fat. Good fat just does so many things. It feeds the brain. Your brain actually prefers fat. Cholesterol is a good fat. When it gets deposited or sits somewhere it's not supposed to or stored in your arteries, it's not supposed to be stored there. But yes, your brain prefers that. Your people think your brain prefers sugar and stuff like that. No. You do have to have so much sugar in your body at any given time or you'll die without it. But it's funny because too much and you've got a metabolic disaster, not enough, you'll die. But your pancreas is telling the story of it's doing all that for you. It's transporting the fats where it needs to go. Your triglycerides are beautiful. And yes, I would say under 100, but when that triglyceride's high, you can go look at your liver is functioning and every time those two are going to go hand in hand. If one is high, the other is high. If one is low, the other one's going to be in range. These are just numbers at this point, but they do tell a story and they do matter, and I'm able to help other people understand their labs. People pay me for that. I don't tell people what to do. I don't tell them what to take. I'm not your doctor, but I can help explain your numbers to you because just like you, people are given something and told, "Oh, you need to take a statin," and you take that home, and you don't even understand what you're looking at because they love to tell you, "You're gonna have a heart attack if you keep this up," and you don't get on your statin, like, by the time you're 45, like I was being told way back 10 years ago.
yeah. I
Instead of
mean,
saying, "Go change your diet and lifestyle," but you
yeah,
go in there to the dietitian and they're telling you, like, to eat, half a cup of rice with everything, and they're not even telling you how to eat, they're just telling you they're taking all these things from you, they're not explaining to you, you have fatty because I had fatty liver disease, obviously, with 988. No telling how long those were that high. I mean, like, probably my entire adult life till I found them. And then talking to other family members, and it's like that's common for us, but that's not okay. Like, you are, yes, you're gonna triglycerides that high. Yeah, you're brewing up a heart attack. That's not good the longer that goes on. There's other things you can do before you have to resort to something like that. I
Yeah.
would think for the most part, those type of drugs, they have a purpose and they do have a purpose. I'm not gonna say they don't, but they have been mispurposed.
Yeah, they have, it's like they look at that number, your LDL's over 100, let's put you on a statin. So this is this is a
Which
one.
drives your good fats down. When people are on statins, your HDL goes down, and so what they'll do at that point, they're like, "Well, your statin is good. I like your level that you're taking of that. Oh, your LDLs look great. Your triglycerides look great. Even your total cholesterol, but your good fats, your HDL is low. This is not good because when you have a really low HDL, that's another good indicator of your heart health. That's why I say you really want that like 60 and up. Like, I've at one time, I know I at one time in the past, I'd had mine down around, like, 41. That's not okay.
Yeah,
But that's when I was on the statin, I was doing everything they asked me to do. See, I've already done that. I did that for 5 years, and I can show you those numbers and what those look like. I did exactly what they asked me, and now this is all food. I don't take anything but insulin. That's it. I take insulin,
yeah,
and I've lost, like, 48 pounds.
yeah, yeah. Well, I
My mental
refuse.
health is better, my physical health is better. I'm 46 years old, and I'm healthier now than I was at 35, you know what I mean? And
Yeah,
then I was gonna ask you what your total cholesterol was. Mine's 251, and it kinda stays anywhere from I look 230 to 250. That's
mine
kinda where I
was
stay.
mine was really high. I can't remember what it was.
But kinda once again, you take the total cholesterol and your LDL, those numbers are gonna be a little bit higher, but when those kinda just you just kinda have to say, "Look, I'm just gonna have to, like, look at those and those are what they are." When we were kids, do you know the standard was 300 or less?
I know the
Did you
numbers.
know that?
I didn't know what the numbers were, but I think ever since after the 1970s and then after the 1980s, the numbers have changed
1980s, yeah. Yeah, they've
dramatically
changed it with the statin drugs. It
because
just kinda mysteriously started evolving and just got
th
lower,
that's
lower.
because the statin business is a billion-dollar industry. They have to have customers.
So let me ask you these questions and you'll see where I'm going here in a second because you already probably know, but just so other listeners can maybe follow and figure it out. So if you're on a statin and it's driving your HDL, it's driving all your numbers down, but let's talk about HDL in specific. Let's say it drives everything down to make the doctor happy. Runs your HDL down, which is your what?
That's your good fats.
Good fats. If it runs those down and so you're starving your brain of what?
Food. Brain is
Good fats.
yeah,
Yeah. Okay. So we're talking about good fats here. So if you're taking a statin, it drives down your good fats. Your brain prefers
starve
good fats.
so you're
You're
starving your
starving your brain
brain.
of good fats. What happens when we start starving our brain, which is cholesterol? People need to stop thinking of cholesterol as a bad word. That's a good fat. Cholesterol is a good fat.
Is it
When it gets stored in the arteries, that becomes a problem, but it's still not a bad thing. It's just evidence of, hey, this is getting stored improperly. This
mhm.
shouldn't be here. Your calcium scan let you know it's not getting stored there. So does now tell me, does your cholesterol mount to a hill of beans to you? A number. Tell me. Do you care now that you know that? You've seen your own calcium score. It's
No,
not getting properly and stored in your arteries. So if you started taking a statin and your body's already properly working, whether it is or isn't, you're starving your brain of good fats. And then what disease comes with that?
it's Alzheimer's disease.
Dementia,
Yeah,
yes. Yes, there you go. So, like, if you just follow that logic, like, that's not a conspiracy, that's not something you and I have come up with. Like, anybody can go read it doesn't matter what you pull up and read about, that'll never change.
that's science.
Yes, that's it. You can't change that. So, when we take these statins and we're affecting the wrong numbers, and just like that, it goes and makes your numbers look good, but what's really going on in your body? It's like there's a hole outside in the road and the cars are we're having to, route them another direction and send them another way, reroute them. So let's say I go out here and get a big piece of plywood that's thick enough to withstand tires driving over it, and I go cover the hole and I say, "Oh, it's all better now. We can drive across it." Is that hole gone or did I cover it up?
Yeah, you put a Band-Aid over a problem.
And so how long is that board's gonna last? A while, right? But is it gonna last forever? And does it address the hole? No, we covered it up, but does that even last forever? Enough cars drive over it, what's gonna start happening? It can only take so much weight, wear, and tear. It's gonna start cracking, and I'm gonna have to come put another another board, not even the same board. I don't know. This is just how my brain works, and this is how I understand and break things down for other people. It seems to work pretty well. But I mean, we don't have to overcomplicate this. I mean, just make sure if you're going to take a medication, know why you're taking it. Make sure that that is the best option for you. And yes, if you've had a heart attack or a stroke, we're not talking about that. We are not even qualified to talk about that. That is not our expertise. That is not our profession. But as far as these numbers and what they mean, it's not really that hard. It's just understanding what your numbers, every individual's numbers look different for a reason. It may be because you have heart disease. It may be because you're brewing up a heart attack and you may have one next week and you don't know it's coming. You may have one tomorrow. Okay. And then you may be like us and they're just like, we're getting thrown in there where they just want to throw all these numbers together instead of looking at us as an individual. Look at your numbers collectively. And then, like you, scaring the crap out of you. I've been in your shoes probably 5 years ago. But then you were like, okay, well, I'll just go get this other test. That was for peace of mind because your numbers are great. Your lifestyle is great, and you've even had cancer and stuff. Your thyroid cancer, and I'm just saying, even you were like, okay, you've had a lot going within the medical, which is why we have this podcast because we don't trust healthcare, uh, and stuff, and the way that our system works. Okay, I really am okay, and now you're fine, and that's fine. If that costs you $130, not many people can go pay $130 for that much peace of mind. So
Yeah, I mean, I will go before I do anything, I'll go and I'll research it first, before I commit to anything, and especially with my mistrust of doctors in the healthcare system, I'm gonna go on there and I'm a librarian and I'm gonna go read some studies, and speaking of studies, I found this study that I wanted to read because I thought it was very important. So I read a study that and it showed that 75% of patients hospitalized for a heart attack had cholesterol levels that would indicate they were not a high risk for cardiovascular event based on current national guidelines. Specifically, these patients had low LDL cholesterol levels and half of those had optimal levels. So, if 75% of the people who had heart attacks had a normal or low LDL, then 25% had a high LDL. So, it's contradictory to what we're being told. You're being told that your high LDL is going to cause you a heart attack when 75% of heart attack patients had a low LDL.
my next question to someone who had those type of numbers, who had such great total cholesterol and had such great LDL, I would wonder, do you take a statin? And then my next question would be, do what do your triglycerides and HDL look like? Because if your HDL is severely low and your triglycerides are like, I don't know, 200, that tells me that metabolically you're not transporting and storing fats, like they're not moving around in your body properly. So I would care less about how many numbers were on the highway. Like LDL is like a bunch of cars on the highway moving around taking fats places. That's why I say that number doesn't mean really anything to me. If that number's low, I'm a little bit scared myself because I know I eat, right? I'm eating 3 times a day, sometimes snacks, depending on my activity level. So I need cars on the highway, like taking fat and transporting it, storing it, and moving back over here. I don't want to see that number low. That would scare me personally. That's like me going to downtown Dallas on a Saturday afternoon and there's no cars and there's no people out moving around. I'm like, what the hell's going on?
Yeah.
Where's the people in the cars? Do you understand my analogy with that one
Yes,
too? It's
it's
like
great.
where this LDL, this is a low dense lipoprotein. Like this is responsible for this tells me how many cars are out moving around. I don't care how many cars. I just want to see some cars, significant amount.
Yeah.
And then like the cholesterol, that's the amount of cholesterol your body is producing. Like once again, I may go out in the sun every afternoon. I may have a little bit better cholesterol level than you. Cholesterol is a good fat, but, yeah, you people need to start with your triglycerides and even just go look at your forget the HDL, LDL, and all that fun stuff. Go get your triglycerides done. Ask for your triglycerides and ask for your insulin levels. They need to be, like, probably 8 and less. This means that your body is taking in if your insulin and your blood sugar is in check, I can almost guarantee you everything else is working fine.
Well, one more thing I wanted to bring up super quick. So the doctor which I like my doctor. So they scare you that your LDL is high, but then you go get the coronary artery scan and then you find out it's 0 and you're like, "Oh, that's contradictory." So I found this buried online. It's an excuse, I think, to give this contradiction of why you would have a high LDL,
It's the
but
propaganda.
yeah. So and you guys can look it up, I won't go into it. It's called lean mass hyperresponders. And this means that you are a metabolically healthy individual on a low carb or keto diet who happens to have a high LDL but low triglycerides. So, this is the excuse they give for people who have a 0 on their calcium score but a high LDL. They'll say you're a lean mass hyperresponder. You're on a low carb diet, but you're metabolically healthy. And basically, there's no explanation. You're just in this group of this lean mass hyperresponders. You're an anomaly. So you can look it up. It's called lean mass hyperresponders.
Okay.
I thought that was very interesting. But this concludes um, our podcast on the coronary artery calcium scan or the calcium score test. If you've had your lipid panel done and you want to see physically how much plaque you have in your arteries, this is what you would do. Very simple. It's also affordable. Maybe your insurance paid for it, maybe it won't. But the calcium score test is like the gold standard of is there plaque building up in your arteries? All right. And one final thing, y'all, we are not doctors.
Nope.
So always check with your doctor, be your own advocate, do your own research. And we're just here to discuss things going on in our life. And we hope you enjoyed our podcast. And we'll be back next time with a different topic.
See
Bye
y'all
bye.
next time.
Bye bye.